My name is Specialist Schilling. My MOS is 68 Tango Animal Care Specialist. I've been with the 218th since January 2012.
My name is Major Lauren Petcher, and I am a veterinarian at 64 Alpha with the 218th Medical Detachment.
My name is Specialist Bush, and I'm a 68 Romeo for the 218th Medical Detachment.
As a 68 Tango, our mission, it would be animal care, emergency care for military working dogs and contract working dogs, and also their annual and semi-annual checkups.
We are out here on our FTX working with some of the new equipment that we just refielded during our recent USAM.
And what our job basically is, we make sure food is safe for human consumption.
Today we've set up our hospital and we are giving training and cross-training to the 68 Romeos and training to the 68 Tangos on how to use anesthesia, scrubbing in for surgeries, dental procedures, and emergency care procedures.
One of the pieces of one of the sets that we're working with right now is the 50-patient animal hospital. This is a brand new set for us. We've never had anything like this before. It's kind of an expanded version of one of our smaller hospitals that we're used to working with. So there's a lot of new and more involved equipment that we're training up on right now.
Basically, this is how we spec food. Basically, we have different vendors and establishments that we go to, and we do checks to make sure that they're storing the foods correctly, and basically that vendors are doing what they're supposed to do to service the soldiers, and to make sure basically that the Army is getting what they're paying for.
One thing that we've done in the field was setting up this whole hospital. We had to figure out exactly how we wanted the animals to flow in, from in-processing to pre-surgery and exam room to scrub room and an operating room and a recovery room. Setting up the equipment, making sure everything works, figuring out all the equipment, and then also training other people on the equipment.
Some brand new equipment that none of us have worked with before, kind of a more detailed and involved dental. Its machine, for example, is pretty much on par with some of the human dental machines that you would find in the dental units, and we're just familiarizing ourselves with those pieces of equipment. Another thing that we're doing, we've got a lot of new soldiers new to the unit, and so we're familiarizing with some of our field gear, getting everybody up to speed on how to set up camp, how to live out in the field. The goal of the 50-patient hospital set for training purposes, this time we're just focused on equipment familiarization and setting up the hospital itself. The next FTX that we do, the plan is to work in some live animal surgeries, potentially some tissue training using some training aids. So
here in the field is to get some hands-on experience on doing food inspection. Us Romeos, we do cross training with the Tangos, which is the veterinary side of the house. So just in case we need to help them out with any of their situations. So it's kind of good to know both sides of the house, so you can be able to help out your teammates if they need help from us.
Vets have one of the best jobs in the Army. We get to work with just the most amazing patients that there could possibly be. The military working dogs are, kind of the highlight of what I get to do. They're so dedicated. They give everything that they got to you, and the handlers are amazing guys to work with. We get to travel all over the place in the course of doing our job. The other part of what we do is food inspection, and so in the United States here, we travel around to all of the various places that the Army procures food from, inspect those plants. Overseas, downrange, we travel around to all the different FOBs in our AO, inspecting the food facilities, making sure that the food is safe for human consumption, keeping the soldiers safe. So you get to see a lot of things and go a lot of places. Do not confine so much to one location like some other groups are.
I think food inspection job is awesome. I like food. It's just interesting to see what can happen if food is not stored or handled properly.
I've been with the 218 218th since January 2013. I like the 218th. We're learning a lot of the field procedures. I came from TDA in Germany, Dog Center Europe, so I didn't deal as much with the field equipment as I am getting to deal with it here now in the 218th. We have a lot of camaraderie too.
I've been in 218 for 3 years. 218 is a well-knit family, very good motivation, and just it's actually my first unit, so.
The 62nd has been very supportive of our training efforts. We've gotten a lot of support as far as equipment that we needed. If we didn't have the personnel with the right qualifications that we needed to make a training event happen, they've supported us in every way that they could. So we really appreciate that.
Med is pretty good at keeping families on tap when soldiers are going downrange. I know for my family, they kept them well knit. What was going on, when we was going, when we was deployed.
The 62nd Med Brigade, I like being in it because there's a lot of camaraderie. There's something I'm not used to with the bigger unit, bigger brigade actually. I really just enjoy getting to know the vehicles and the whole Army side instead of the clinical side.